Well, thank you for joining us for our first podcast of 2024. I thought what we would do is start with just a summary of how 2023 ended from a policy and advocacy perspective, particularly in terms of activity on Capitol Hill and activity in the federal agencies that are responsible for driving kidney health policy. So I'm thrilled to be joined again by David White, who will provide a quick summary of how the year ended. But we're also joined by Zach Kribs, who will, once we've sort of moved forward and we start thinking about 2024, Zach will help us understand what's happening on Capitol Hill, recognizing that we don't have 6 hours for this discussion. So it's going to have to be the pithy overview, and then David to talk a little bit about what's likely to happen at a regulatory level. So David, Happy New Year, and let's get going.
Happy New Year to all of you guys, and Zach, is always fun to be with you. I'm going to be real brief because there were a couple things that really did come to a head in December, and one of them is one that does come along every December, and unfortunately, there's always too short of a timeline. It's called MUC. Now, doesn't that sound interesting? MUC stands.
So what's the acronym? Because there's also MOC, maintenance of certification. That is not the subject for today's podcast, but we will be talking about that in the future. I'm guessing that's not what you mean.
No, MUC is measures under consideration. So all of our members know what it's like to have measures issued that are things that govern what should be reported and what should be gauged and what should be valued in nephrology care, as in many other areas of healthcare. So when the measures under consideration come out in December, there's a very short timeline before they have to be at the Centers for Medicare and Medicaid Services, or as we just say, Medicare. And that deadline is by February. So during the month of December, we had the measures under consideration, the MUC list, and in that were four particular measures along the lines of what would be of importance to our listeners that are in nephrology. Three of them are for payment to our members under the MIPS program, the Merit-Based Incentive Payment Program, and how those are calculated in the whole overall quality payment program. So in that one, they were divided up. They tried to make them look aligned, but they did silo them somewhat. There was one that has to do with care, CKD care, kidney disease care, one that's ESRD, or kidney failure care, and one that is transplant care. And so that was a large amount of time to go through those and provide some input. There was also one that will be in the quality incentive program proposed, which has to do with a quality of life survey mechanism for patients who are undergoing dialysis. And so that one I think will almost definitely be in rulemaking this year. There's already what we have is a technical expert panel being asked for recommendations to be started in February to go over that one. So that one's kind of a given. They're expecting CMS to use that. What we also had, and then when we get over to Capitol Hill, was Medicare Advantage has been on everybody's mind a lot, and there's a lot of activity around it on Capitol Hill, as Zach knows, in this past year and the year before that too. There's also a lot of issues going on around Medicare's regulation of Medicare Advantage. We have some very, very, very important issues that we really want to have dealt with Medicare Advantage, but particularly for this moment in time, we had December to evaluate a couple particular points, and the points that we really stressed from ASN and other members of the kidney community were the points around prior authorization within nephrology and Medicare Advantage, and also a practice that absolutely we cannot say enough about how much we oppose. It's prior authorization for actual dialysis services, which is just really does not make sense.
But David, I just want to understand. I want to make sure I understand what you're saying. Are you saying that nephrologists have to get prior authorization to place someone who has kidney failure on dialysis?
Since it's Medicare Advantage, these things happen according to which insurer. So yes, there have been cases in the last year where some of the Medicare Advantage insurers have asked for authorization, have asked for details about why somebody was being placed on dialysis. And of course, our members know there is no reason to place somebody on dialysis other than the fact that their kidneys are failing, and there's no other medical reason to do so, and that it is not something that's really commonly abused in healthcare. It is something that is only done as, I don't want to say last resort, but it's only done at a certain time. And so that is a really big concern for us. We do not want anything to do with prior authorization around dialysis needs. And that's just wasting time and could jeopardize the health and the outcomes of the patient. And that's just plain wrong. So we couldn't have been more clear about that. And we will continue to work on Medicare Advantage this year because there's going to be a lot of others, but those were the technical changes that we were addressing that have been provided for calendar year 2025. And so that's, and getting us through 2024 to 2025 also is something that Zach has got to carry a lot of water on. So Zach, how about
Yeah, I guess, thanks, David. Before Zach goes, just I think it's really important for everyone to understand we're talking about 4 or 5 different sort of years here, all within a 2-year span. So we have just started calendar year 2024. The federal government's fiscal year started technically on October 1st of 2023. Fiscal year for the government 2025 starts October 1st of this year, 2024. And then we have calendar year 2025, as you're talking about, which starts a year from now. So there's a lot of moving timelines here that just adds to the confusion. So Zach, with that as entree, curious as to what you think is going to happen over the next couple of weeks and months on Capitol Hill.
Yeah, thanks, Todd. Great to be joining you and David and Lauren for this conversation this morning. Uh, Maybe to start off to kind of ground this conversation, Todd or David, do you remember back when we had cable TV or broadcast TV when they would have reruns on the networks?
Oh yeah.
Did you have a favorite rerun show? I know Friends was always a staple in my youth. There was always a rerun of Friends on.
I hate to admit it, but throughout my life, I've enjoyed the reruns of Star Trek. And I'm actually old enough to remember when the show actually premiered.
I'm not entering into this conversation because there's no winning answer for me. So, and I'm afraid to ask Lauren if she has a favorite rerun. So why don't we kind of move forward, Zach?
Well, I raise this because I think as we look ahead throughout calendar year 2024, which, as Todd, as you mentioned, includes a couple of different fiscal years this year, I think we can expect to see a lot of reruns in Congress around many of our policy priorities and issues. I think the chief rerun we were leading up to right now is government funding, both for fiscal year 2024, which again is the year that the government is currently in, also for the next fiscal year 2025. And so we've seen last year this kind of epic drama play out where a speaker lost his control over the speakership because of a fight of government funding. We started this year with an optimistic deal to avert a government shutdown, which is currently scheduled for a partial government shutdown, which is scheduled for January 19th. So coming up really quick here. We saw recently House conservatives revolt again on government funding issues, slowing up House procedure because they're not satisfied with this deal that Speaker Johnson reached. So I think that we can expect to see some reruns around from last year around some of these government funding deadlines. That's not to say anything around fiscal year 2025. All of these thorny issues that are in fiscal year 2024 are going to stay in fiscal year 2025. You're going to have all the same members of Congress, for the most part, negotiating these deals. So I think we can expect to see a lot of the same questions. Optimistically, hopefully FY24 provides a roadmap for FY25. And I think in best case scenarios, we can see, for the most part, level funding with some strategic increases across the government for health funding for fiscal year 2025.
So Zach, you had sort of an aside there I just want to pick up on, because I know with Representative Santos no longer in Congress and Representative Johnson moving to become the president of Youngstown State University, the margin between the Republican majority and the Democrats minority in the House is thinner. But you don't see that as being sort of relevant to this specific discussion in terms of how to reach agreement on finishing the funding for this fiscal year.
I think it's a very relevant conversation. I think what happens now with the Republican majority being even slimmer than before is that there's fewer votes to lose. And so I think those members of the conservative caucus here, I think specifically the House Freedom Caucus is what I'm thinking of, they made hay out of having kind of a sizable proportion of the Republican caucus vote during the ousting of Speaker McCarthy, or former Speaker McCarthy. Their power has only increased with fewer Republicans in Congress. Now, this also means that Democrats' power has also relatively increased. So I think under kind of any other year, we would probably have seen Republicans vote even tighter to avoid the Democratic minority that is, again, nearly half of the entire House. But I think my comments around personalities is that we do expect to see a lot of the same people in decisions of power calling these shots. I think you can expect to see, again, repeats, a lot of the same voices, raising a lot of the same concerns, and probably getting a lot of the same outcomes.
Zach, do you have a prediction on what you think happens for the January 19th deadline, the first of the deadlines that we meet? Is that going to need another mini CR, continuing resolution, or what are your?
Thank you, David. I think this is a topic that will certainly be outdated as soon as this podcast is released. The beginning of this week, I thought we were going to meet that deadline. I think looking at this podcast is being recorded midweek. I think I'm less optimistic about that. Certainly, we've seen Speaker Johnson say he wants a continued resolution tying all the funding to the second funding deadline of February 2nd. That is the thing that House conservatives are rebelling again at. So we'll see if Speaker Johnson can put down this minor rebellion or if there is some sort of broader concession. Keep in mind that Democrats still control the Senate, the White House, and almost half of the House of Representatives. So the negotiating room is relatively small for Speaker Johnson.
So Zach, just to pick up on David's earlier Star Trek reference, so it seems like Speaker Johnson potentially could be one of the cast from Star Trek, from the crew of the Enterprise, who's wearing the red shirt that gets beamed down to the planet and doesn't come back with the delegation. I guess I have two questions. One is, how likely is that to happen, that there is a revolt and he's replaced? And what does all this mean for kidney health policy? And then I guess the third question, since you mentioned the Senate, is what, if anything, can the Senate do to help kind of find us a path forward here to keep the government funded, not have a shutdown?
Those are all great questions. They're very big questions. And I'm afraid that any answer here, again, is really going to miss a lot of the fast-moving developments. For my view, I think that there is very little appetite to have another war on who gets to lead the Republican Party in the House of Representatives. Having said that, I thought there was very little appetite the first go around, and that consumed about a month of Congress's agenda. I think the Senate is definitely interested in making sure that these deadlines aren't missed, that there is a path forward. We've seen Senator Schumer in particular take a more leading role in negotiations, particularly with the White House, even though that, again, he is kind of the same party as the White House is controlled by. So I expect to see some kind of quiet leadership. At the same time, I have not seen the Senate very eager to clean up what they perceive as probably the House's mess on some of these negotiations. So I expect them to kind of keep doing what they have been doing, which is put out very kind of thoughtful, quiet legislative vehicles and kind of prepare for all possible eventualities with the House of Representatives. One area, if I can bring this conversation more towards kidney health, and actually this is taking a quick detour with physician payment. One area where I think this is of interest is inclusion in November legislative package put together by the Senate Finance Committee of a partial avoidance of the physician pay cut that is already in effect as of January 1st. So as David and Lauren and you've discussed before, there's a small physician pay cut included for anyone participating in the Medicare program of up to 3.74% through the conversion factor. That's even higher for people who are participating in certain accountable care organizations. The House has led legislation. Actually, the Congressional Kidney Caucus co-chair, Dr. Bouchon, has led the legislation to avoid the full payment cut on the House side. But we saw, again, the Senate Finance Committee include a partial fix for this physician pay cut in their November PBM package. So I think looking forward, it's probably much more likely that we see something like the Senate's proposal ultimately adopted. Doctors are putting a lot of pressure on Congress to have a fix for this during one of the packages that addresses this looming government shutdown on January 19th.
Yeah, we really struggled with this as the physician fee schedule was being crafted. And this is where, our space is kind of interlocked, because in the regulatory space, they were trying to spread that out in certain ways, maybe not quite as onerous for nephrologists as some of the other specialties. But the catch is that it is all bound by budget neutrality, which is controlled on your end on Capitol Hill, right?
Absolutely. And we have not seen very many serious proposals to be rid of budget neutrality. There is legislation that ASN has supported that would include an inflationary update for physician payment. Physicians are kind of the one area of Medicare that doesn't have any tie to inflation. I'm not sure that's going to go anywhere, again, particularly where some of these budgetary constraints are for these big fiscal year packages. But again, I think this is where we use this framework of reruns. I mean, physicians come to the Hill almost every year asking for some of this pressure to be reduced. Congress eventually lets into this, but this is, again, the same show that plays out every year.
So I guess before we go, I just wanted to give our producer Lauren a chance to see if she had any questions or if there's anything that we've discussed that she would like us to try to clarify.
Yeah, so Zach and David, you might be able to weigh in on this question. You said that the original physician fee schedule cut was around, I think, 3.4% to be exact. Do you know what number Congress is thinking for a new cut? Like how much they're trying to curb that back?
Thanks, Lauren. So there are two serious proposals out there currently. So the Dr. Bouchon's legislation, which is named the Seniors Timely Access to Care Act, that would remove the full cut in its entirety. So physician payment would remain the same as it is in calendar year 2023. Now, the Senate Finance Committee proposal would reduce the cut from 3.4% to 2%. So if that's kind of the pathway that Congress decides to take, we'll see still some cuts facing physicians above fiscal calendar year 2023, but it'll be a little less than they were expecting.
How that exactly gets played out on the physician fee schedule side when CMS takes the money and divided is a little bit we're not completely sure of, because they're originally they had planned a 1% cut for nephrology with their 2% for nephrology for the services provided in dialysis facility, but not the cut for the EMM coding, which got us to about a 1% overall cut. But we'll see.
And I think that this does not incorporate all of Congress's proposed agenda for healthcare this year. We've seen a lot of momentum on telehealth and certainly some short-term telehealth extensions at post the public health emergency for the pandemic will be expiring this year. So I expect to see some action on that. We also saw, again, I mentioned the Senate Finance November package, but both the House and Senate package addressing pharmacy benefit managers. So I think something around that policy will probably be implemented by Congress through this year. And it'll be definitely a vehicle that a lot of the healthcare lobbyists like me are looking to attach other important policies. And certainly at some point we can talk about ASN's congressional portfolio and wish list for this coming year. I think there's no shortage of, I think, small and very actionable fixes we hope Congress can take to improve kidney health.
Well, thanks, Zach. Yeah, I think just to close, you make a really interesting point in the sense that last year, the first session of this Congress was the least productive in recent memory. And I think it was fewer than 25 bills were passed and signed by the president. However, one of those was the legislation to completely transform the U.S. transplant system, which has huge implications for nephrologists and was something that ASN and other members of the kidney community advocated for. So despite sort of all the challenges we have with the gridlock on Capitol Hill, there are opportunities for us to advance our legislative and regulatory priorities, which is terrific. So appreciate your joining us today. And David, as always, it was great to have this conversation with you. And Lauren, thanks for producing, and look forward to our continued discussion in the weeks and months ahead.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.